Cardiovascular. Let's talk about some different terms that we may hear when we're discussing the cardiovascular system. The normal heart rate, when we're talking about our, our pulse, is going to be 60 to 100 beats per minute. Cardiac arrest would be the complete stoppage of cardiac function. In other words, the heart's not beating. Tachycardia, tachy meaning fast. So we know our normal rate is 60 to 100, so it's going to be a rate that's greater than 100 beats a minute. Bradycardia, so brady meaning slow. We know our normal heart rate is 60, so bradycardia is a heart rate that's less than 60 beats per minute. Palpitations are a conscious awareness of one's own heartbeat. People will state, I can feel my heart beating, or I feel like my heart's going to jump out of my chest. I just feel it palpating. A thrill is a palpable vibration during the palpation of a pulse. A murmur is a sound made by turbulent blood flow in the heart. A bruit sounds like a murmur, but it's heard in the blood vessels. And cardiac output is the amount of blood that's pumped out of the heart every minute. So when we're auscultating, for this class, basically, I just want you to auscultate the heart. Usually we're looking for the apical heartbeat. The heart sounds that may be auscultated, or heart sounds can be auscultated, whether the client is supine, semi-Fowlers, high Fowlers, or left side lying position. When you are auscultating, you instruct your client to breathe normally as you listen to those heart sounds. At this point, basically, I am just after you recognizing the normal lub-dub, lub-dub, lub-dub sound the heart should make, or the S1, S2 heart sounds. If you hear additional sounds, those are considered abnormal. If you hear kind of a swishing or unusually prolonged sound, sometimes those are indicative of that turbulent blood flow. You could be hearing a heart murmur, but you are not expected at this point in your career to be able to diagnose heart murmurs. You just need to recognize normal versus abnormal. As we palpate pulses, again, we never assess the carotid pulse at the same time, but otherwise you always assess pulses bilaterally at the same time to compare the strength, the rhythm, and the rate. They should be regular in rhythm and they should be equal in strength. As we're grading that pulse, the strength of the pulse, 4+ is that really bounding, that really strong pulse. And we usually feel this in someone who has fluid volume overload. 3+, we have an increased strength. 2+ is normal. 1+ is weak, and 0 is absent. So as we're doing our interview, we always want to know family history. The majority of health issues do have a genetic component, and cardiac is really high on that list. How much stress do they have in their life, and how do they cope with it? Are they smokers? Do they drink alcohol? How much caffeine do they take? Do they exercise regularly? Or if they exercise, how often? What type of exercise? What is their fat and sodium intake? Have they had recent weight gains or losses? Are they short of air? Is there any particular activity that causes that shortness of air, such as exertion, or do they have it with lying down? Are they dizzy or fatigued? This can indicate hypoxia or a decreased cardiac output. Are their rings or shoes getting too tight? This can indicate swelling or edema, as can just assessing ankle edema. The leg color, we want to assess that. If it's very pale or has pain with walking, this can indicate arterial disease or obstruction. If they're dark red with brown discolorations on the shins, this can indicate venous insufficiency. Do they have sores on their legs? These are very common with arterial or venous insufficiency, and they're usually chronic. In other words, they don't want to go away. Do they sit or stand for long periods of time? This can lead to varicose veins, venous insufficiency, or potentially deep vein thrombosis due to venous stasis. Excuse me. So as we're doing our assessment, we always want to start with vital signs. The heart rate, respiratory rate, blood pressure, and oxygen saturation are very important. They give indications as to the health status of the client and clues to changes in conditions. Heart rate, we know, can be affected by fever, pain, fluid volume, hypoxia, anxiety, exercise, cardiac disease. When we're looking at the blood pressure, again, the average blood pressure in a healthy young adult is 120/70, with 120 being systolic and 70 being diastolic. Things such as anxiety, fear, and stress can elevate that blood pressure in addition to illnesses, fluid volume overload. Make sure you take the blood pressure in a quiet room with a relaxed environment. Let them sit several minutes prior to taking that blood pressure. Don't allow them to talk. You don't talk. Feet flat on the floor, the arm with the blood pressure cuff. Blood pressure cuff should be at heart level. And if you get a really off reading, take it again about 15 minutes later. We know that blood pressure is going to be affected by the amount of blood being pumped out of the heart every minute, the posture, muscle activity, and respiratory action. Auscultate the heart sounds for the S1 and S2, and what is its rate and rhythm? Is it regular or irregular? Do you hear additional sounds? We palpate pulses, usually the radial pulses and the dorsalis pedis pulses. We can palpate the others if issues are suspected, but again, remember to palpate them bilaterally at the same time and assign a grade to it. Normal is 2+. Always palpate with the index and the middle finger. Never palpate with the thumb. We check the capillary refill in all 10 fingers and all 10 toes. It should be 3 seconds or less. And always assess for pain using the pain scale. If they have pain, what is the characteristic, frequency, radiation, alternating factors. Look at the skin color and temperature. Again, with poor circulation, the skin can be pale, gray, ashen, or cool to touch. Assess their hair growth, especially on the legs. If it's sparse, that can indicate a poor circulation. And assess for edema. If they have edema, is it pitting or non-pitting? Edema is best assessed over the tibia. And if they have edema, how extensive is it? So is it mid-shin? Is it ankle? Is it just in the feet? Is it dependent? So we have someone who has been ill for a long period of time and they've been laying on their back. Do they have dependent edema? So basically anything that is touching a surface. So maybe they're sitting in a chair for long periods of time. Anything that's touching a surface, which would be the buttocks and the upper thighs and the feet, that would be dependent edema. Gravity is what we're looking at. And how high does it extend? So we've done our assessment. What do we do now? We may administer oxygen if a client has chest pain, significant tachycardia or bradycardia, a significant abnormal rhythm. Again, we would apply oxygen in these situations regardless of their saturation levels. MONA is the acronym for treatment required for someone who is reporting chest pain. It consists of morphine, oxygen, nitroglycerin, and aspirin. Limited activity, if they're complaining of chest pain, decreases the workload of the heart and decreases oxygen demand. We may put them on a heart monitor or telemetry so we can continuously watch their the electrical activity of the heart. IV access. If they're complaining of heart issues, cardiac issues, we may need to give emergency medication, so we may need a saline lock. We always reassess with a change in condition or after we have done any interventions. Different diagnostics that we may do would be blood work such as cardiac enzymes, troponin, a BNP, which would indicate congestive heart failure, or cholesterol levels to determine how much fat is in the blood. Different diagnostics other than blood work may include an EKG, an echocardiogram, cardiac catheterization, and an angioplasty.